everyone. I am happy to be back at the Board of Health. I'm going to call the meeting to order. This meeting is being recorded by the City of Greenfield. If any other persons present are doing the same, you must notify the chairperson at this time. The chairperson reserves the right to remove or have removed any person or persons for profanity, threats, or continued disruption during the meeting. We are going to start with a review of the previous month's minutes. We did not meet in August, so that puts us back in July. I'm going to abstain from that because I was still out at that point.
Did we table the vote at that point?
Actually, yeah, because Dr. Romano is not here, right? Yeah, so
Yes.
I'll move to table that vote.
Second.
Oh yeah, great. We don't need to vote on that. Great.
So I appreciate that you're going to have us move to the end for the green burials. I'll just give an overview before Laura speaks. I've been working with Elise for a little bit. We've been talking on and off about green burials, which is basically being buried on her property in a way that she wants. She did write a note to the board on August 29th, 2023, as requested for the board's permission. I did send Laura the guidelines that are needed through the DEP and the DPH, which they do meet. It went through Eric Twarg in zoning, and they passed the zoning recommendations. So it's not near a well, it's not near any wetlands. I did send, so I sent you the letter, I sent you the regulations, I sent you the DEP's regulations, which they did agree to. I will have Laura speak at this point. Laura?
Well, excuse me, it's too bad my mother isn't here because she's the one that's driving this forward. And she feels very strongly that she doesn't, in terms of the environment and effects, and she feels like green burial is the least obnoxious way to go for the earth. She's also a very spiritual person, and she has this beautiful labyrinth on her property. And the GPS coordinates that I sent in are sort of in the leading up to the center of the labyrinth. That's where she would like to be buried. And, I looked at all of the maps and things, and it looks like it's definitely not close to any water or, septic systems or anything like that. So it seemed like it would be a good place for her. I mean, if not, obviously she would do a green burial wherever it's permitted. Like I think Gil has one. I'm up in Leiden. I'm not sure if Leiden has something, but we're hoping that when that time comes, she's got her shroud. She's had 2 shroud parties where her friends have decorated it and, sewn things on or, attached feathers. And she's got another one coming up if she can make it, because again, she just fractured her left hip. So she's going to be out of commission for a little bit. But if you guys have any questions, hopefully I can answer them.
And Alyssa and Sam, at this point, since you guys, I'm assuming, read the regulations and everything passed, it would just be up to a vote or just, discussion vote. So thank you.
Yeah. We reviewed the letter and the regulations. Sam, do you have any other questions or discussion before we take it to a vote?
No, I think I'm all set.
Great. So I'll make the motion. I guess I will move that we approve the green burial for Laura. I'm sorry, what was your mother's name again?
That's okay. It's Elise. Legally,
Elise.
She's Rosalie Elise, but she goes by her middle name, Schleicher.
Schleicher.
The J's like a Y.
Okay, for Elise Schleicher. as
Second.
outlined. Thank you. All in favor?
Aye.
Great.
Aye.
My mother will be absolutely thrilled, and this, if anything's going to get her up and walking again, it'll be this.
I am
That's
so
great.
happy that
Thank
we can
you.
do that. Thank you, Laura.
Thank you,
And you
Jennifer,
don't,
for
if
all
you
your
want to
help.
stay, feel free.
Nope,
You're
that's
very
okay.
welcome, Laura.
I've been in,
We
I've been in
don't blame
Springfield.
you.
I've been in Springfield a lot lately, and my husband would like to see me for a little bit today.
Well, thank you, Laura, very much.
Okay,
Thank you.
thanks.
Take
Have
care.
a great meeting. Take
Thank
care.
you.
Bye-bye.
Okay, thanks for rolling with that quick rearrange. Megan, you are up with nursing updates.
Yeah, so I'm just gonna go in order of the minutes. So COVID and communicable diseases. COVID, we had some really high spikes in our wastewater at the very beginning of September. This last sample, it started coming back down to the moderate. So I think that it might be getting a little bit better, although we are hearing of more clusters with people that are doing home tests and things like that. So that's going to keep us, the clusters are still in the red, but the wastewater's in the yellow. So we might be starting to trend down. Other communicable diseases, everything else is starting to slow down. Our tick-borne diseases, tuberculosis, things like that are starting to slow down a bit. Oops, sorry about that. I don't know how to shut that off. Okay. Letter to superintendent and daycare providers. We did send a letter out to all of our daycares and schools. I mean, every camps, everything that you could imagine, asking them to report all communicable diseases. It is required for them to do so, but I don't think people really realize that they were supposed to do that. So we did send those letters out, and we did it to all of the towns: Greenfield, Deerfield, Montague, Leverett, Shutesbury. We may have missed a couple places just because we didn't know about them, but we went in the phone book. We looked on Google. I mean, we sent out over 100 letters. So hopefully people are understanding that they need to report now. And that'll help us with other things like norovirus and GI bugs and, you know, everything that that we need to be aware of. Public health nurses. I called the nursing homes and all of the private schools as well. And we explained that they needed to report into Simple Report or other reporting tools as required by the state because of CLIA waivers. So I think some schools were not under the impression that they didn't actually have to report into Simple Report anymore, but they actually do because they have a CLIA waiver. It's not just because they go under DESI guidelines. I did a TikTok at the Greenfield Senior Center, and that I just went in and explained the dangers of tick-borne diseases and gave out free bug spray and things like that. They seem to really like it. I also did a meet and greet at the library, just so that people would know who we are. I gave out COVID tests and lots of free samples like chapsticks and deodorants and things like that. We had a lot of our unhoused population came in, which was fantastic because they got to know who I was. And another thing that I did just recently that's not on the minutes, but I took a wagon downtown and had Narcan and hygiene supplies and toothbrushes. I mean, everything that I have in my office, I put in the wagon and just went down Main Street and asked people if they wanted to pick out anything from the wagon. And that was a really good experience. And it was great to connect with people. And we actually were given xylazine test strips, and those aren't available in Massachusetts free anywhere right now, but we accumulated some and we handed those out and everybody was thrilled. I wish that Massachusetts would start providing those because it's something that we really need. And I've been mentoring bachelor program students at the health department. They said that they have a really hard time getting into clinicals. So I'm like, well, you can come hang out with me as much as you want. So I've done over 50 hours with them. I would say it's probably closer to 100 hours with them. And then this weekend we have the community baby shower on the town common with a bunch of different agencies. So the Greenfield Health Department will go there and we'll have a booth and we'll hand out baby bags with diapers and things like that for new parents. And I think that that is about all for my update. Does anybody
Well,
have any questions?
September, did you have the flu clinic?
Oh, yeah, I didn't see that. Sorry. Yes, so I am doing flu clinics and COVID clinics. I've organized several of them through Cataldo Ambulance. There's going to be 3 at the Greenfield school systems. I'm going to have 1 at the Weldon, and I have 2 in Deerfield. Actually, that would be 3 in Deerfield. I just got approved for 1 more. Some of these are flu clinics, some are COVID flu clinics. I'm arguing with the state right now to get all of these covered so that they will pay for COVID as well, as they don't pay for flu, but so that the state will pay for it, because when we opened up the Deerfield site, we had 108 slots for COVID and it filled up within less than 24 hours. And that's not enough. We need a lot more than that. So the state should be approving more of those. And if not, I will reach out to the senator. And I also have flu shots in the health department that I've been giving out. I just keep sending out pop-ups information saying, come today for a flu shot if you want. I've had 22 people come in the office and I've done 2 home visits. I think that is probably all. I do have more home visits coming up. They're just getting me a list of people now.
Oh,
Great.
and the tapestry is working out with the broken sharps bin getting replaced at the park. And we are trying to locate the porta potty company at this point. It is through Tapestry. They have it there, which I was kind of a little confused about. So I need to follow up with that. But that will be getting replaced.
Great. Love to hear about those flu and COVID vaccine clinics and home visits. That's really exciting. Thanks, Megan. All right. Property updates from, oh no, sorry, we're not onto property. Jennifer Lunt property update, which is sort of right on track, it seems.
So on August 7th, we received notification from the OHI engineering group. That is the LSP that's working for the PIP group, Mr. Lyon Wittens. And he gave a review written to Mr. Ziegler, who is the Lunt property LSP that the city has been working with, and the people that are at the Lunt property itself. And basically the CP wrote back on September 12th to the city and basically gave similar recommendations of things that have to get done. Some are indoor air sampling for volatile chemicals seasonally, and the homes that have to get tested, talking about migration pathways northward of the property, as well as horizontally and vertically, monitoring the wells a little bit better. And basically they want that within 21 days of the state of this letter, they have to submit review and approval for proposed schedule and timelines for public meetings. So that is the update. It's moving along, and that's all I have for one.
And the yes, Mayor.
Hi, Alyssa. Nice to see you. I just
Hi.
wanted to make a slight change to Jennifer's report on the Lunt property. Mr. Ziegler is the EPA Western Region person. Bruce Nicholson is the LSP that works for not Fuss and O'Neill, but O'Reilly, Talbot, and Oaken. So just a small. Didn't want anybody to be confused about where John Ziegler was working these days.
Yes, thank you. Yeah. And that's Jennifer, just to clarify, that's the seasonal air quality testing that the DEP, that's like from
Yes.
their routine.
Yes, as well as monitoring
Yes.
wells and all that. Yes, correct.
Yeah.
And I'm sorry about that misstep. I was just like looking at the name. So thank you, Madam Mayor.
Okay, did anyone have, Sam or, Dr. Lepre, any questions about?
No question.
Great, great. Restaurant updates for August, and there are a lot of them, so have at it, Nicole. I think, oh, there we go.
Actually, I'm going to hand this over to Jess.
Hi.
Oh, great.
Hi. So I'm going to start here at item 2 with the KFC Taco Bell closure. Obviously, this has been an ongoing back and forth with KFC Taco Bell, where we have closed them, we reopened them, we closed them again and reopened their dining room. We've been in very close communication with their district managers and with their plan moving forward on how they're going to continue to maintain their space and not have to have continuous open and closing issues with keeping everything sanitary and up to code. As of now, they've been communicating well as requested to let us know anything before we find out from somebody else. And so far, so good. Their dining room is open, drive-thru is open, they're serving food. McDonald's on Federal Street, closed, then reopened. McDonald's on Federal Street was closed for sanitary reasons. They were extremely receptive and accountable and did all of the corrections that were required, which was quite a few in the form of 25 to 30, if I'm correct, different violations. They fixed all of them overnight. They brought in a pretty serious team of what appeared to be district managers and people that were very important in their investment group and made plan moving forward on paper that they turned into us at the health department regarding retraining new managers, assignment of tasks, and how they're going to continue to do that. They've also been requested to let us know if there is any work that's going to be done in the building before it happens. The reason that they were requested to do that is because we did get a report that there was some work being done in the kitchen while they were preparing food. And at that point, we immediately went over to find that there was, in fact, painting that had happened that did drip onto one of their prep stations. At that point, they were fined and informed that all work that occurred needed to be communicated to us. Shortly thereafter, they said they did communicate to us, said that they were going to do some work and ran into some other complications while doing that work and decided they were going to close their store and proceed on with a more major renovation, which is why they were closed for a prolonged period of time. That was their choice. They did not initially inform us, but did call and leave a message later in the evening that was not received until after the office had closed. So although we were not initially informed during business hours, they did call us after and let us know, and then waited for us to come and do a reinspection before reopening. So I would say, again, McDonald's Federal Street is being monitored pretty closely and feeling really confident moving forward that they've got a handle on things, and they've been very accountable and are actively performing the plan that they have suggested moving forward. Number 4, the hangar. The hangar was inspected for an annual inspection very promptly. When we went into the inspection, we were concerned about a number of things. Nicole and I both consulted, and after seeing, again, a very large amount of pretty important violations and issues of food handling, we closed their store and gave them a number of different suggestions on how to make some improvements and modifications so that this wouldn't happen again. If I'm correct, I think they reopened in 3 days after closing.
Yeah.
They did everything. Everything was checked out. Again, they were told to please communicate anything to us and let us know if there's anything we need to know so we don't find out from somebody else. And as of now, they have been doing that. Item 5 would be Subway Mohawk Trail. Subway Mohawk Trail was closed. I want to say this was on a Wednesday. They were closed not for any sanitary purposes or anything like that. They were closed because all of the employees that they had, none of them had any Serve Safe certifications. Not even like a regular food handler Serve Safe cert. So there certainly wasn't anyone there at the manager certification, which is required by state law. So their store was closed until they were able to get an employee manager Serve Safe certified. They were not able to do that within the first 48 hours. So they scheduled their employee to have an exam on a Friday evening, and in an effort to make it so that the store could open on Saturday morning, I waited until the owner informed me at 10 p.m. that the person did pass and sent me a copy of the Serve Safe exam pass, and then I told them that they could reopen in the morning. So their Subway Mohawk is pretty solid. Mesa Verde went there for their annual inspection. Outside in their back trash area, there was 3 very large barrels of used cooking oil. Additionally, I think there was probably maybe 10 to 12 empty quarter keg barrels and just some miscellaneous stuff that didn't need to be there. So after their annual inspection and seeing those items, connected with the owner, and she informed her that those vats of oil could not be stored there and they needed to be promptly removed. She had them promptly removed along with all the other items that were back there, and that space has been maintained. Item 7, Applebee's. I have absolutely nothing to say other than they did a fantastic job and everything was really on point. I mean, I was really happy with the way that the restaurant looked and that their manager was asking questions about things in the future and how to kind of stay in that area of perfection, so to speak. 99 was okay. They had some minor corrections that were needed regarding their food storage, and they promptly did those corrections on site. Primarily it was like loose container lids and improper saran wrap that just wasn't securing things. Generally speaking, there was no major issues. Everything was minor and was corrected on site. So again, moving forward, I think that they are all set for the rest of the year. Number 9, China Gourmet. China Gourmet had some minor corrections that were required regarding their labeling. I wasn't entirely shocked that there was some issues with their labeling, and I informed them that all the items needed to not only be labeled, but they could also be labeled in the language of the people that were accessing the items, so that they were being not only correctly labeled, but being able to be read by the people who were preparing the food. Because obviously that's going to be the most important point for reducing foodborne illness and or cross-contaminations. They were extremely receptive. They were literally correcting labels and making them and asking me if that was what was supposed to be happening while I was there before I left. So I was really happy with that. Item 10, Friendly's trash outside, instructed with manager to clean. So Friendly's has had staffing issues, and that has often been a reason that has been presented as to why they have not been able to maintain certain areas, which include but is not limited to the trash outside. So we did go there and connect directly with their new manager, whom is very aware of the fact that this needs to be maintained, and even if there's a lack of staff, that doesn't mean that the sanitary stations suffer because of it. We've been there twice to connect with them about this, so I'm hopeful moving forward that it won't be a continued problem. Oh, the rehab. Yeah, sorry. Item 11, Greenfield Rehab. Greenfield Rehab was great.
It was Poet Seat.
Yeah, it was Poet Seat. It was great. I was really impressed with the manager there.
Yeah.
Like he knew everything he was supposed to know and some more. He did a great job of kind of following around to ask questions about if there was anything wrong or if a correction needed to be made. He asked questions about things in the future, how they would, can we store it this way? Should we put it over here? So I was really impressed with their manager in a whole and had no issues with that particular location. Okay. Item 12 was a big Y. There was a worker complaint of a skeleton in the break room. So there was
Rat,
there was
right?
a photo that was sent to the health department of a rat skeleton. And so Nicole and I went promptly to investigate, and we did find the location of where the photo was taken. There was not a rat carcass there. After connecting with the manager, we put the pieces of this puzzle together that there was a former employee that was very unhappy and was terminated, and this employee had reached out in a number of different areas, including social media and the health department, to make claims against Big Y. And come to find out, this rat skeleton was actually a Halloween decoration and was not real. So, in conclusion, there was no carcass there. There was not ever a carcass there. And I was very happy to hear that.
I need to interrupt 1 second, but this is why we have to verify all complaints by seeing it, hearing it, tasting it. We can't just go by someone's complaint. So I really appreciate, even though time was wasted, it just justified why we have to see everything with our own eyes. So thank you.
All right, item 13, Stop and Shop complaint, broken coolers. So promptly responded to the complaint of broken coolers. We walked in, we temped out every cooler that was suggested to be broken and more. We did not find any coolers that were not working correctly. We did connect with managers on site who said there had been a cooler issue and that they had contacted I'm assuming probably Arctic, and everything was working and at the correct temperatures. They did say at the point where there was a refrigeration issue that they pulled all the items and had somebody come fix it promptly, which is likely why we did not see anything, because it had actually been fixed.
Cooler.
Yeah, we saw an empty cooler that was broken.
But they have to sit for a while and like recharge before they can be turned on and have food put back in them.
14, McDonald's Mohawk Trail. McDonald's Mohawk Trail, minimal findings. I mean, they had a number of things, number meaning like 5, 6, 7, probably things that needed to get corrected. Nothing that was major corrections, all of which were minor. We did write them in order to correct and came back in 30 days to check, do our reinspection, and everything was stellar. Additionally, the group of managers, investors that were present during the McDonald's Federal Street scenario were also involved in making sure that McDonald's at Mohawk Trail was going to continue to be at the same standards as the Federal Street store was going to be maintaining. So again, felt really good with that response. Subway on Federal Street. Ice machine was filled with mold, broken tiles on the floor. The floor was spongy. The store was closed due to a repair not being compliant. The owner did not get proper permits for the work that was done. There's been a number of points of exchanging information with employees that they have said that the owner demands they show up to work if they are sick, and if they don't, they could be terminated. He has also suggested to them that they are complaining to the health department, and if they continue to complain to the health department, they will be terminated. I've personally been at this particular location probably at least 5 to 6 different times.
They were not
owner-
respectable exchanges.
Absolutely not.
It was very contentious and rude.
Yeah, the owner was not very receptive. Not only was he not very receptive, he had an endless amount of excuses as to why there either a repair didn't occur or needed to occur and could not, and also was very insistent that we break the law and allow him to keep his store open when there was obvious issues regarding employee safety. So this is a location that's going to need to be continuously connected with regarding employees and their safety behind in the counter, so to speak. There's a lot of floor issues going on there that I suspect likely are not over. I am hopeful that with the relationship we are maintaining with the employees, that they will continue to communicate to us anything that they're experiencing, because it seems like they are very much trusting of our department and specifically of myself and Nicole, which feels great that we can continue to address the issues as they're coming in promptly, and that they're feeling heard and received, and that they're being addressed. 16 El Chepacinto food truck. They passed their inspection. I'd say so far so good. They apparently are getting great reviews on their Facebook, social media, everything Greenfield, all those good things. So
And he's on his way to opening a
yeah,
second truck
second truck is going to be opening
over at the
soon.
mobile by the Rotary.
Item 17, Mohawk Falafel Shawarma. They actually just reopened after some complications with finding translators and whatnot. The reason the falafel shawarma was closed is because unfortunately the owner did not have the correct certifications. So it needed to close down until he could get the correct certifications, which has now happened, and it is reopened. September.
You pretty much covered that one.
Yeah. September, item 1, Federal Street. I mean, I'm going to refer back to 15 because they're pretty much all working together in the world of not working. We closed the store again after having issues. Got a piece of information from an employee that there was work being done on the floor that was spreading sawdust all over the food stations and into the prep area. I promptly went down there and again found workers working on the floor, and they were very quick to attempt to finish their work and leave when they saw me arrive. And they did not complete the work because they were so eager to leave once I was present. So again, this is just more work that is happening on the floor that seems to be the never-ending battle of Federal Street Subway. And I am hopeful that the repairs that have happened will be maintained and keep the employees safe. September, item 2, the Moldovan church kitchen was probably the most immaculately clean kitchen I've ever seen in my entire life. Yeah, that was perfect. Everything was shiny. Nothing was wrong. Everything was where it was supposed to be. I couldn't have been happier. Probably the easiest inspection I've ever done. Item 3, New Fortune. New Fortune, I did a follow-up for them after their initial inspection, came back in 30 days. They had some issues with food storage labeling. Additionally, food storage coverings, and they needed to do some better cleaning in their cooking area. There was a lot of grease buildup on their Ansel system and just on their walls in general. So I again informed them that the labeling was important and that the labeling ideally did not have to be in English and should be in English and also present for whatever the most common language is being spoke by the people accessing the food, so that they knew they were not only getting the right things, but were able to maintain ordering them correctly in the sense of order of operations for food and meat storage, which was the biggest issue there, was just how they were storing meat and other foods was not the correct order. After returning for the reinspection, everything looked great. The owner was extremely receptive, and I think probably did even more than was necessary regarding labeling and cleaning. Brad's Place. I went to Brad's Place at probably the height of their breakfast and went directly down into their basement. And again, I was pretty happy to see that they had labeled everything on the exterior of the refrigerators and freezers downstairs. And when I opened them, everything inside was as it was labeled on the exterior. Everything was dated correctly. There wasn't mess everywhere or debris. I went upstairs, looked in their cooking area. I mean, they have an open kitchen there, so it's pretty transparent what you can see, and everything looked really good. I mean, again, it was during like the height of their breakfast time, and there wasn't endless food debris everywhere. The owner was present. We communicated well. I had absolutely no feedback for him other than stay keeping things cleaned up and maintaining the space. McDonald's on Federal Street, that would be the reopening after their impromptu renovations. That was when they had passed their re-inspection after their impromptu renovation. Elks Lodge, very similar to the Moldovan church, very clean. They were not much to report in the world of anything negative or suspicious. Everything was where it was supposed to be. Everything was stored correctly. The ice was right. They were very receptive. They had all the right certifications, and they answered all the right questions. Backyard Butchers, that was interesting. Everything was fine. I was not expecting to pull into a 18-wheeler tractor trailer truck with a freezer section in the back containing endless boxes of ribeye steaks, but that's what it was. And everything was fine. Festivals, Homey Collective. Interesting experience, and there was a lot of food being served, a lot of different varieties of foods, and a lot of different vendors. We spent a lot of time up there going through everything and making sure that everybody was following all the proper rules for outdoor food service. We did have to do a couple modifications and corrections on site, suggestions for folks. Everything was well received. Nobody had any negative reactions to any of the suggestions that were being made or requirements that were being made. Franklin County Fair.
That was a week long.
I think we spent like
a week doing it all,
going back and forth and trying to get all the inspections.
We had like 30 vendors this year.
And we also tried to go and like get ahead so that we weren't like leaving it all for one day. And it absolutely had the opposite effect because nobody was really expecting anyone to eat early. So there wasn't a lot of people there early, which I think would have been very helpful had there been more people there earlier, more vendors, setting up. But they weren't expecting us early, so I can't necessarily say I'm that shocked.
Nicole, was it better than last year? Because last year everyone showed up at the very last minute. Were there more people this year on time, closer?
Yeah, it was. Yeah, it was better. They were ready. There was only one person that showed up on Friday at 3:30, right?
Yeah,
that one guy.
No, you went
MJ's breakfast.
Saturday.
Oh yeah, that lady on Saturday.
Yeah, there was one guy who showed up.
There was a new vendor this year, the farmer's daughter, who she turned in her application late, and she was not ready on Friday, and I had to go out on Saturday to catch her because she was just not around on Friday. So I don't know if she just doesn't get the point of making money at the fair, or
and ideally you need a permit before you start serving food.
Yeah.
So Nicole had to go out on a Saturday and handle that. Wormtown was full of a lot of very smiling vendors. They were very chilled out and didn't seem to care that I was there. I did all the food service inspections that day without having any issues with feedback from anyone. Anything I told them they needed to fix, they fixed. Any And
Everybody had their applications in early, even Solar Cafe.
it was pretty smooth.
Wow,
And-
wow, wow.
And they were all smiling. I was just so surprised. God. All right, your turn.
Okay.
Whew. Before we jump into housing, just anyone have any questions on that very comprehensive restaurant update? Okay, great. Just wanted to give you a minute to breathe. Thank you very much. And yeah, on to housing updates.
So 12 Montague City Road, and Jess and Nicole were there. I'm actually writing the sister of the owner not right now, but prior to the meeting. It's an ongoing situation, but that house was on our radar for several years. We delayed condemning the home because the gentleman living there is elderly and sick. So much so that our public health nurse, Megan, would visit him and help him. He was admitted at one point and went to a nursing home, and he was doing really, really great. He was engaging. And then in one day, I was contacted by the police department as well as the sister, saying that everything's really, really bad. I requested that Nicole and Jess go out to that home, and when I will have Nicole report what was found.
So Jess and I went out pretty early. It was probably 9:30. We went out with Officer Llewellyn and Captain Alex Cooley and somebody from the sheriff's department to speak to Alan about the conditions inside his home. I was aware that they were not great, but entering the home, it confirmed that they were totally just not habitable, especially for his conditions. Just it wasn't safe. It's just not safe in terms of us in keeping people safe. He just could not be there anymore. So we started off talking to him about how it would be better for him to go and try and get some help. He had some medical conditions that needed to be addressed. So tried to ease him into speaking to Officer Llewellyn about getting help, gave him some resources. Obviously, it wasn't that easy. We spent probably 3-4 hours there before we made any progress. But the house is boarded and secured. It's had a few little bumps.
Nicole.
Yep.
So just so everyone's aware, the buildings department was on him he was a former junkyard owner. So there was a lot of stuff outside as well. And he refused help time and time again. And that's why when Megan made that breakthrough with him and with our department, we were thinking he was making a turnaround. And then he turned right back into where he wasn't taking care of his property or himself. And it was time, it was about, I would say, 3 years that we've been working with him. And, and to give him motivation, at one point he accumulated up to $15,000 in fines. And as he was getting better, I was taking away the fines, thinking that it would motivate him to clean the house and his property or get help. And it just totally went way worse. So I'm sorry to interrupt you.
So finally we had I believe it was CSO that came out. I think she was from CSO.
Yeah.
I think that she was going to go over to the hospital with him because of she was concerned about his medical condition, as well as that is something that Meg was concerned about, which is something that she was monitoring. And that was a breakthrough that we had with him. In terms of the property, it sits where it stands right now. We've had a couple bumps in the road with stuff going missing. Some people have just gone there to like fix their vehicles. I assume he's just telling people, yeah, hey, you can set up there and like fix your vehicle there. But that's not the case with a condemned property. You can't step foot on a condemned property. That's considered trespassing. $1,000 fine, or you can be arrested by the police department. In terms of the property that is right next to it, so that's 10 Montague City Road, we did make contact with the tenant that lives in that house one day when he was coming home from work. We scheduled an inspection with him to take a look inside his house because we were notified that the inside of his house looks exactly the same, almost exactly the same as the inside of Alan's house. But he never showed up for his inspection, so we have not attempted to go back and do that one again. But we will, because
Can't avoid us forever.
yeah, he's not going to be able to avoid us forever. But I'm sure it's not very nice inside. Yeah, I don't know what I think 128 that's a mistake. Go ahead with 10 Stanley.
10 Stanley. All right. I'm going to go to 10 Stanley Street, the kitchen floor violation. So this particular apartment, apparently the tenant and landlord are not friends. We'll just say that. And the tenant has been very aggressive with people from the city, his neighbors, his landlord. So apparently there was a small breakthrough, and I connected with him for a little while, and we went in and inspected his apartment. Did find some major floor issues in there that needed to get fixed. We communicated this to the landlord. The landlord attempted to hire a contractor to come in and fix the floor, and the tenant has denied entry to the landlord. So at this point, the floor has not been repaired and likely will not be repaired because the tenant is not allowing access to the apartment.
So 116, 120 Elm Street. Some of you may recognize the sound of that address. We've been dealing with this property since 2021. We condemned 2 units out of 3 of this property. The beginning of this year, I believe it was,
Due to
we
lead.
have for lead. We have moved one family back into apartment number 2, and apartment number 1 was needing to be de-leaded. So I had to go over there and do a minimal standards check before they could move in the last family that needed to go back in. Got de-leaded, had to get de-dusted, where all the dust residual had to be taken off the window sills of the outside, the inside, the doors, everything, just so there was nothing that could be breathed in by a child, anything. So that passed for minimum standards, so that family could be moved back in. So there's no condemned units there right now, and I haven't heard anything about that property at all. Knock on wood. 83 Elm Street. There was a complaint of so the complaint was from 83 Elm Street, from a close by neighbor, that there was rats coming over from chickens So we took this property as a barn inspection. In the past, this woman has not wanted a lot of people on her property, but we had a great experience with her. She was kind and let us right onto her property. We wanted to make sure that all her grain was locked up. She didn't have tunnels where rats were. All the bedding was picked up. There wasn't piles where rats could live under. Everything looked great. I didn't see any droppings, nothing like that. So I don't think that's where the rat situation was coming from, but just making relationships with people who had bad relationships with previous health department encounters is something that I really like to do. 204 Main Street, also known as 6 Chapman Street. This has been ongoing for a while. This is an apartment that is above the Vic. This is starting to be more of a tenant landlord squabble. They are going back and forth at each other. Tenant, it knows the rules.
May I
Yes.
interrupt?
Yeah.
So, I also speak to the head of the landlord association in Greenfield about this person, who's also the contractor for this property. And definitely a more of a civil issue at this point, and looking for reasons to, get the tenant out, but not get the tenant out. So there's multiple people involved, but I think it's becoming more of a civil issue at this point.
Oh, for sure. I definitely can tell that because the tenant knows that when you have an order to correct put on the landlord is not allowed to do any type of retaliation for 6 months. So that's stuck on them. And every time they have an order to correct, it just adds more time where the landlord can't make any judgment against them in court or anything. Doesn't matter if they owe thousands of dollars in rent. So I have just been going in there. He just wants to know what he needs to do to fix whatever he needs to do in the apartment. So that is what I have been doing for this landlord as well as the tenant. She wants stuff fixed too. So I've been working with them on both sides. Do you want to do
419 Deerfield Street. That's not opening. Condemned. Let's skip that one. For a minute.
291 Chapman Street because you were there when the police.
Okay, we're gonna go down to 291 Chapman Street here for a second. So this particular address has had so many countless complaints and concerns being called into the health department regarding trash in the yard, in the front of the yard, in the back of the yard, in the driveway. I went to the house. Nicole and I went to the house a number of times trying to make contact with anybody without any luck. One day we did get somebody to come to the door and communicated to him that there was concerns within the neighborhood. It wasn't taken very seriously, and we continued to try to go back to the house and follow up without receiving a lot of answering of the door. At one point I went back to the house and knocked on the door. Somebody did come out, communicated with her. She was not happy that I was there, and we spoke for a few minutes and I left. Shortly thereafter, a few days later, I got a phone call from dispatch saying that they were requesting for the health department to come over. And so I went over and was very promptly greeted with the police department inside, removing the owner of the home, and there being approximately 3 adults that were very unhappy that anybody was there. And one of the people that was there threatened my life and expressed how very displeased she was that anybody was there that was from the police department or elsewhere. I did have to make a judgment call to inform DCF of some concerns that I had while visiting the house previously and during my encounter when the police were there, that there was a child living in the house, and I had seen what appeared to be drug paraphernalia and some pretty unsanitary conditions. So DCF is involved, the police department is involved, and we are currently still working on gaining entry to inside of the house to do a full inspection and assess from there.
It's just not safe right now.
Yeah, as of now, it is not safe for the health department to be going there and trying to inspect anything until the police department has told us that we are safe to be present and are not at risk for being harmed by anyone inside.
Okay, so I figured out 419
Okay.
Deerfield. Okay, so 419 Deerfield Street. That is a vacant house. Yes. There is no water. It is just from looking outside and looking in the windows and on the porch. It is filled with trash. There's trash outside. The yard is overgrown and the yard has grown over the trash. There's unregistered vehicles there.
Beer cans everywhere.
I have not heard from the owner, who also happens to be Alan Osachek, who owns 12 and 10 Montague City Road. He has not contacted me that I have condemned that property as well. Oh, yay. 6668 Phillips Street. This was a collaborative with all of us. We condemned this. We worked with animal control as well, the police department. The tenant is going through eviction. We were working with LifePath on this, trying to work with LifePath on this. We have gone to court multiple times because the house is ruined because of the amount of animal urine and feces that was inside the house. The animals that were taken out of there needed medical attention. Mostly the younger animals in there, the kittens, they were infested with fleas. There were 3 dogs that went in there as well that had skin conditions due to the amount of.
May I interrupt?
Sure.
The only thing some reason I'm interrupting is when we say fleas, we mean that the inspectors, as well as one of the vehicles for the city, are now contaminated. What?
Yeah, I don't have them anymore.
Because of that property. It was.
Is she mute?
Jen, you're muted.
Okay.
Do you hear me?
Yeah, now I can.
Did you hear anything I said prior?
No.
So about the fleas, it was so terrible that, and this was the first time I had the inspectors go home to change because one, they smelled that bad. And one of the vehicles of the city became infested with fleas because it was on their clothing. And it got all in the car. So that vehicle was out of commission. So when we say it was horrendous, we mean it was absolutely horrendous. So hopefully that gives you a visual.
Yeah. We were made aware of this property by an outer source medical team that was going in and doing services for the tenant there, and they said we can't go in there. we can't breathe in there. It's making us sick. And when we went in there, we knew right away, like, this is bad. It's bad.
I think we were all hoping that what was being communicated was being exaggerated.
It was not.
I think it was actually the opposite of exaggerated.
Yeah. So
Yeah.
so we're still in court for this. Still going on. They're still being allowed to try and fix this to go back into the house.
Jess is actually going back in the beginning of October.
4042 Coleraine Street. I'm just gonna start with the unsafer building. Okay. So
Well, 4042 started with the dog. So that started 2 months ago. And then it just escalated into a bigger thing, and then buildings got involved. And it's still ongoing as of an hour ago. So I'll let you talk now.
yeah. So on August 31st, the buildings department was called out by a contractor working on 4042 Coleraine Street to let the building department know that there was 10 to 12 feet of foundation missing on both sides of this house. There are 1, 2, 3, 4 units in this house. One was an elderly woman. One was a family of 2. One was a single dad with children, and another was a vacant apartment. So the building department deemed the entire building unsafe. We had to get the landlord to come out, which was very difficult. Explain to him that he needed to relocate all of the tenants, which is a regulation that is something that we need to follow. He needed to relocate all the tenants. He was responsible for their food however long that it was going to take, that he had to put them up for. It has been boarded and secured 3 times? 3 times now. Because I don't know who's going in it or who wants to go in it, but somebody is. As of an hour ago, we were removing a previous tenant from the property again. So I had 3 officers from the Greenfield Police Department and 1 sheriff letting that previous tenant know that you cannot be on condemned property. So you're going to get an $1,000 fine from me every time you step foot on that property, and potentially arrested by the Greenfield Police Department. It's not that confusing to understand that, but he just needed some clarification. So that is 4042 Coleraine Street. Should we go to September? Is that's Ebony?
Yeah. All right.
Okay.
September, 46 Deerfield Street. This one, 46 Deerfield Street. I initially visited with Nicole and then went back for a follow-up inspection 30 days later. The original inspection was happening because the tenant was suggesting that there was some issues with water damage and or mold and or other miscellaneous rodent problems and things that she was quite concerned about. So we went there, and the first thing that I promptly saw was that an entire panel of the bathroom ceiling was missing. And again, was kind of hoping that she had been exaggerating, and that was not the case. So there was an order correct that got written regarding the different violations that were in the apartment. Landlord followed through with like 1 or 2 of those corrections and did not follow through with the rest of them. I have communicated with the landlord again and written a new order for them to correct, updated, and I have been in communication with them, and they are actively making those corrections now. Greenfield Gardens. The rodent complaints don't seem to end. They're in like every building.
Every day.
Every
Every
day. It's either someone's calling who's very sad or somebody's calling that is very mad. And it appears like every time one of us or both of us or any of us go there, we are seeing endless evidence of rodents. We have received endless feedback from tenants that most of the suggestions of rodent control are them being handed pieces of steel wool or mesh netting to cover areas of entry points. There it has been shoddy craftsmanship with repairs and patches in almost every apartment that has made one of these complaints regarding rodents. And I'm going to assume that likely these patches have happened over entry points where rodents are coming in. I mean, I can only say that I have not been to one apartment that has not been completely correct about them having rodent issues, whether it was a spotless clean apartment or one that could have used a helping hand. They all have the same thing, and it's endless rodent droppings and urine everywhere. I was actually over there yesterday, and I brought an ultraviolet light with me and found scratches all over the ceiling where the tenant was suggesting they were hearing scratching, which indicates to me that there is rodents scratching where they said, and that they're not wrong. Additionally, found endless evidence to support this while I was there. So I think it is likely that Greenfield Gardens is absolutely a rodent safe haven at this point.
Okay. Well, the Winslow and 9 Mill Street are the same thing.
Yeah.
And I don't think we did that. Okay. So, do you want to do the Winslow? You did one.
Oh yeah, so Winslow, the one that I did at the Winslow, I got a call from Greenfield or
Greenfield Housing Authority.
Director Hoffman sent me a message from Greenfield Housing Authority regarding like an emergency request for an inspection. So I went there, and the tenant was there, and the apartment was filled with a lot of empty cans and bottles and such, and a lot of fruit flies. The tenant was insistent that they could not maintain the apartment on their own and that they needed help doing so, and that is why it was in that condition. I explained to the tenant that they needed to clean the apartment, otherwise the consequences would not be ideal for them, and he was insistent again that he could not do this on his own. And I did let him know that if he could get up and walk around the apartment and go to and from the fridge to drink something and leave it on the counter for an empty container, he could easily throw it into a trash bag. So he didn't seem like that was a terrible idea, to put a trash bag with all of the empty waste containers and throw them in there as they are consumed. OTC was written for that, and I hope that it was corrected.
Okay. The Mill House, they call for MRVP inspection. So whenever they have a vacant apartment, we go out and do an MRVP inspection before somebody else moves in. An MRVP inspection basically saves a landlord's bottom. They cost $75, and it makes it so we go out, we take photographs, we fill out a certificate saying that it passes, it has this, and this, it looks this way. So if there's any discourse later on between the tenant and the landlord saying that this is broken, we can figure out where it went wrong or who did what. So the Mill House and their MRVP inspections. And then the second Winslow inspection was done recently. It was a gentleman who was nearing end of life. They were trying to figure out what to do with his belongings. He doesn't have a lot of family. I reiterated to Greenfield Housing Authority what the regulations are for taking out somebody's belongings. So they are responsible for putting somebody's belongings in storage for 6 months. So that's what they have to do. They have to pay to keep somebody's belongings in storage for 6 months until somebody either gets them, or I'm not sure what happens after that, but I know that's the rule that they have to follow. Maybe they can get a hold of, he did have a partner. So maybe they can get a hold of her or some family along the line, but that is what they were looking for. I didn't go there.
I can't remember.
237 High Street. Wow. Okay, so 237 High Street. Jess and I went there together. This is a repeat housing inspection. This house is it's a sublet house. So the woman owns the house and she has 4 subletters in the house. So they rent the rooms individually. They share refrigerators, stoves, washing machines, everything. You can imagine how that goes sometimes. So what's going on is one of the tenants in the house does not agree with how the landlord is keeping up the sanitation in the kitchen. There were some bug issues in the kitchen, smoke detector issues due to the bugs. They were defecating on the smoke detectors, which was setting off the smoke detectors. We had Captain Alex Cooley come out and switch those out, clean them off for her. We also became aware of one of the rooms was a little overstuffed and had to be cleaned out because that is cause for fire hazard. So that is where that stands. They're within the 30 days, so it hasn't been enough time for us to go out and do another re-inspection. And I know these folks are in court as well. So that might be a little bit of a civil issue as well.
Days Inn. So yeah, I went to Days Inn.
Wait, there's 2 parts. So I'll do August, you do September.
All right.
So I was called by the DPH to follow up on the Days Inn on an order I wrote in July regarding bed bugs. And I went there and I found evidence of dead bed bugs. I was there earlier on and they had to move 2 tenants to different rooms while the rooms were getting fumigated, and there's 3 rounds of that. So they were asking me to follow up. I followed up. And at the time of that inspection, there was trash. The dumpster was overflowing. There were rodent droppings. So I went there back again on August 11th, and I did indeed find 2 live bed bugs. And since the nature of the report, of the place, I should say, they called a state inspector in, and they found different findings. We were called again by the DPH to follow up, and we followed up, and I just asked Jess to follow up on the trash in the dumpster, not necessarily a bed bug thing, because the DPH was working on that with the state. So Jess, now you can talk about that.
Thank you. So I went as requested to follow up at the Days Inn and walk through, check the dumpsters and the debris that could be outside, where the dumpsters properly closed and locked, checking the hallways for general maintenance. I was very disappointed to see that the door for the dumpster locking area was wide open. The dumpster itself was open. There was a handful of mattresses on the side of one of the shed buildings near the dumpster. There was kids' toys and broken bicycles and miscellaneous items just scattered around the parking lot and other miscellaneous areas. Promptly when I walked into the Days Inn, I saw on their ceramic tiling that there was a lot of what appeared to be a sticky, reddish, not pleasant looking substance, kind of dots of it all around. I suspect maybe it was some sort of food debris or candy or something, but it just generally looked like it hadn't been cleaned on that floor recently. I proceeded down the carpeted hallways where the rooms are, and in two of the hallways, there appeared to have been almost no maintenance done. Like all the floors were dirty. There was trash and pieces of paper and little particles of food all over. Additionally, at the end of one of the hallways, it smelled really bad. And from my different experiences here with some particular odoriferous scents, I think it was likely urine. That's what it smelled like to me. I proceeded to walk down other hallways and didn't see as much lack of maintenance in some of those other spaces, but it did appear that most of the hallways didn't look like they were being maintained. The floor area was definitely not maintained, and the areas that I was specifically asked to check outside had not been maintained the way that Director Hoffman had instructed.
Thank you, Jess.
Wow, okay, that's a lot on housing. You guys have been really busy. Thank you so much. I only have one question that came up for me through the course of that, and that is, as inspectors, do you all do mandated reporter training?
Yes. We have to report elder at risk or elder abuse, as well as children to DCF.
But do the inspectors take the training from the Middlesex
No,
County? Okay.
no.
I'm gonna email you some information after this meeting. It's the state training. It's online. It takes usually 30 minutes or so. It's a self-paced course, but it outlines, it does not go over elder abuse training, but it does outline mandated reporting for minors.
Thank you.
Yeah.
Thank you.
Yeah. Does anyone, Sam or Dr. Lepre, have any other questions? Yeah, Sam.
I've taken that training through the schools, so I know the schools all have access to the programming.
Yeah, it's free. It's online. It's through the Middlesex District Attorney's Office. It's the one that we use at the health center.
Well, like you could see, we do encounter
yeah,
a lot of families where there's needs, and a lot of times I'm informed, by the superintendent of schools and concerns, and it's very difficult to, because they report, then we report. So the difficulty is DCF doesn't always respond necessarily. They respond to every call,
right.
but we do report, and
Yeah.
we document every report that we have.
Yeah, and they don't necessarily follow up with the folks making the report, but it can be subjective, and a lot of times, people need support and services, and it's a sort of a resource access issue. So anyway, I just wanted to pass that training along, but we don't
Thank
can
you.
talk about it next meeting too, if we want, but we just have such a long agenda.
Thank
and
you.
we're coming up on time, for this meeting, so I wanna move us along. If there were whether Sam or Dr. Lepre.
Nothing else. I just wanted to say, you guys do an incredible job. It's like to do everything that you do and to encounter people in tough places, tough times for them. I think you guys do an amazing job. So
I can't say enough about my 2 inspectors and the public health nurse. They are unbelievably, I say it every meeting, I think, but this health department runs like clockwork, and I am extremely proud of everyone in that department. They're amazing, and I am forever grateful for the staff I have.
Yeah, thank you guys so much. Let's see if we can get through barn inspections and the perk testing, and
I'll go fast.
got a few more sections, but yeah, let's see what we can get done.
Okay. So I got a good jump on barn inspections. I've done a few more than what are on here. Since this was printed, I have had no issues. I don't think I have to go through every single one. They've all passed with flying colors. Every animal is happy. All have water, shelter, food. They all want pets and kisses. And
Did you
if they
see
come
my
up to
goat?
you,
Did
no,
you
not
see
yet.
my goat boyfriend? I
Not
have
yet.
to see him. I have to
I got
give
to
him
see the mini
kisses.
donkeys today.
Oh,
I don't know if you guys want to do the unhoused part.
I gave that report.
Okay. All right. So I don't need to like go through all the like, yeah, fine. Like, so basically perk in Title V season like goes in waves. It kind of goes with like the selling seasons for houses. We had quite a few in August. I don't know if the failed Title V's have anything to do with the rain, but very well could. The wetter the ground, the worse filtration your system is going to have. So that's August. And then September, we haven't had any. We do have a couple. We have one scheduled for Friday, but it's a re-inspection for a conditional pass that we had like back in the beginning of the year. It was a vacant house. So when you have a vacant conditional pass, you conditional pass it, but in 3 to 6 months, somebody needs to go back out and check it to make sure it's still working properly after it has had continuous use. So make sure the system's still working properly. So that's September. All right. Now you guys can go on to that.
There will be a bigger case probably next month that I'm working on for 172 Highland Avenue Extension. So I've been reviewing the plans. I'm having someone else review the plans with me. And I'm working with buildings department right now regarding that home, but that's going to be a bigger case. So I will give you guys the septic plans to review.
Great, thank you. And grants and municipal, intermunicipal update.
So the intermunicipal grant, we're getting the payment that you see listed, $487,044 in 2 installments. And so far we have now hired a part-time inspector that goes between all the towns, who was the previous health director of Montague. We also we have the iPads shipped out to the software company for Relevant, and they're uploading all the software and all the restaurants and getting all of the city and town data. to upload. So they're going to be up and ready to go. And then all the inspectors are going to begin their training in our towns. And we submitted our FY24 budget. The CDBG block grant is $13,000 for elders at risk. The money still wasn't released to us yet, but it should be imminent. And that I already have a list of people where I am going to be using this money for. The EPA PIP grant, I haven't had any new updates because it's in review. My epidemiologist who I've been working with, Jack Sullivan, since he's on the COVID grant with the COVID numbers going up, I've had him focus on that because that's his main priority and getting data for the COVID grant communities. But we're working on census data and employment data of previous employees. And we've been gathering data on that. And I sent you guys the new contract in the packet. Any questions?
No,
No.
no, thank you. That's really exciting.
Last updates, the walk with the doc, we're not going to do because Dr. Romano is getting married this weekend, and that's why he's not here today. So yay to Dr. Romano. The mosquito update, I received an email from the state talking about the mosquitoes kind of southeast, if I'm using my navigation systems correctly. I sent some updates. But we sent out warnings on the city page and the health department page if anyone's going to be traveling in those towns to use extra caution. And Dr. Lepre, since I know you have a penchant for mosquitoes, do you have anything to say?
No, I think this is just going to be mosquitoes are kind of still around, and mosquitoes that are around right now later in the year tend to be ones that are more likely to have had at least one blood meal, which means that they are more dangerous mosquitoes, which is why you tend to see a lot of the mosquito-borne disease end of summer, early fall, and that's going to persist probably until the first hard frost. So just it's a good reminder that these things are still around, and that it's, the Tripoli in particular is when you get it has a pretty concerning prognosis. Luckily it's not in huge quantities, but you can have significant impairment for people who are infected. So it's really just a good reminder later in the year when people want to sit out and watch the nice sunset like tonight in cooler weather, that there's still pretty significant risk.
Thank you, Dr. Lepre.
Yeah, thank you.
I also sent the board the DEP nuisance guidelines for everyone to review. As you know, we've had some nuisance complaints. The board did their voting or they about aromatic fillers and other nuisance concerns with the town, within the town. So I just sent the board some guidance on nuisance and what the DEP recommends and so on and so forth. And if anyone had any questions with that.
No, but that was helpful. Thank you. Look at that. We really squeezed it all in. It is 6:29. Our next meeting is October 25th. That's a Wednesday at 5 o'clock. I suspect we'll be back in person, but we'll post it, of course, or we won't post it on the website, but it will be posted on the website. And yeah, with that, we've made it through this monster agenda. Unfortunately, we don't have time for public comment this month, but we hopefully will have a shorter agenda next month and be able to offer public comment at that time. So I'm gonna make a motion to adjourn our meeting.
Second.
All in favor?
All right.
Thank you. Thanks, everyone.
Thank you, everybody.
Take care.